So, Michael, please introduce yourself and tell us a little bit about your research.
So my name is Michael Crossland. I'm a Senior Research Fellow in the Institute of Ophthalmology at UCL, and I'm a Principal Optometrist at Moorfields Eye Hospital. And I'm really interested in vision impairment and blindness. So all of my research and all of my clinical work is in people with severe vision impairment. So I mean people whose eyesight is not corrected with glasses or contact lenses, but because of disease of the eye or the brain, have reduced vision, even when we've done all we can optically. And within that large scope, I'm particularly interested in two areas, one of which is the mental health and well-being of people with vision impairment, so how having sight loss affects your mental health. And secondly, about how technology, and particularly new technology, can help people with vision impairment to live a full life and to live independently. And then looking at populations, I do a lot of work with adolescents and young adults, sort of emerging adults, and I'm very, very interested in how having vision impairment affects you at that stage in your life when you're developing your personality and choosing a career and a partner and so on.
Right, so you're not dealing with people who are blind as such, but people who develop vision, problems with their vision.
Largely. Blindness is a strange word. It's under World Health Organization guidelines, people can be called blind but have reasonable amounts of sight. They can see bright lights often, for example, or large objects moving. But most people I see in the clinic and most people I see in my research work are able to see at least something. So their vision would be too poor to drive a car legally, but they would be able to see light from dark usually. So often these are people who would see perhaps the top letter on a sight chart at an optician, or a little bit less than that. And as you say, a lot of these people develop sight loss during their life, either from inherited conditions or from trauma or different processes. But some will have had a vision impairment from birth. So I see both groups of people. Yeah.
And I noticed from your book, which is entitled Vision Impairment, Science, Art and Lived Experience, I was sort of interested in the relationship between science and art, looking at it from a Benthamic point of view, because Bentham had his own view about the relationship between art and science, and these days, at least in Britain, we think of biology and chemistry and physics as sciences, whereas English and history and philosophy count as arts. But Bentham said, no, every subject has its science and every subject has its art. And the way he understood the distinction was to say, well, science concerns knowledge and art concerns the application of that knowledge. That seems to me a refreshing way of looking at the relationship between art and science. And so I'm just wondering, what's your take, given that you've got both in the title of your book?
I think, as Bentham said, these are not distinct phenomena. These very much interact. And a lot of my work is in trying to quantify how well people see, and what better way than somebody expressing this artistically. So an obvious example is visual artists, like the woman who drew the image on the cover of my book, for example, where she tries to explain her experience of having reduced vision through artwork. And yes, I can measure her vision on a sight chart, or I could administer questionnaires asking how it impacts on her daily life and whether she's able to perform different tasks or something. But this is not as vivid as seeing an image of what she experiences as she perceives the world. So I think art can be used to quantify the difficulties you get in the same way, or in a different way, a complementary way to science. So I think these are completely overlapping in my head in ways of expressing what life with vision impairment is like.
And some of your research is concerned with neurodiversity. So how is neurodiversity relevant to vision impairment?
I think diversity is fascinating in all its different connotations, I think. And I think this increased understanding that people perceive the world differently is what the key of this is. And my work is very much on this physical difference, this sensory difference. But I think it interacts very clearly with the way that people with neurodiversity in a more classical sense also interpret the world differently and interact with the world differently. I think it's been a gradual realisation that these things are not in isolation, that there is this real overlap between neurodiversity and this difference between people, and also in the differences in the way people see the world. So I suppose both in the literal sense of how they see the world and in the philosophical sense of how people see the world.
I think you say that sometimes problems are misdiagnosed, that they're more to do with sight?
Yeah, no, so a good example is I see quite a lot of young people with inherited macular diseases. So this has the same effect as an age-related condition in that it affects their central vision, but at a much earlier age, so typically in people's teens. And of course, if you can't see centrally, if I was looking at your face, I wouldn't be able to make eye contact with you because your eyes would disappear as I look straight towards you. So one strategy that people have is they look slightly to one side or slightly above somebody's face so they can still use the rest of their retina to see what they're looking at. And of course, if you don't make eye contact with somebody, then very often teachers will label this with a more common diagnosis of perhaps having autism or social communication difficulty, whereas actually in the people I see, it's very often the more rare condition of losing central vision. So this is one example of where sometimes a vision impairment can actually manifest itself as a social communication difficulty which is not caused by autism or any other neurodiversity. But equally, there's an interaction in that we know that people who don't have good sight, particularly early in life, do also present with autism in many cases. So there is this interaction between neurodiversity and vision impairment.
Right. But I mean, I suppose if you are visually impaired, then like you're saying, you have difficulty then watching television, reading, doing activities that maybe you've done in the past. So does that also lead to other sorts of problems that might be misdiagnosed?
Yeah, I think very often difficulties in recognising people's faces and interpreting expressions is something I hear a lot in the clinic and from the people we see in our research. So a classic problem will be they say they walk past their friends or their neighbours in the street and people think they're rude because they're ignoring them and actually they don't recognise one person from another. But also the social cues, the way you're nodding as I speak to you here is something that may not be as visible to somebody with vision impairment. And it's almost a cliche how much of our communication is based on these subtle non-verbal cues, but it's hugely important for conversation.
Yeah, and I can see how that could get mixed up with dementia because somebody with dementia might not recognise somebody in the street and just walk past them, but also could, like you say, if they're vision impaired, they wouldn't recognise them either.
Absolutely. And I have a colleague in the hospital, a cataract surgeon, who is adamant that we should always be offering cataract surgery to people with dementia. And very often you find anecdotally that people have cataract surgery, their vision's improved, they still have dementia, but their quality of life improves, their communication improves, because there's this joint impact of the reduction in vision and in the dementia itself. So
that's interesting. I mean, does visual impairment affect memory in any way? Is there any connection there?
This is a great question. I'm not aware of any research which has analysed that in a rigorous way. I think people use very different techniques to remember things if they're not relying on vision. But in one respect, I think it's too easy to think this is remarkable. A friend of mine who reads Braille says people often say to him, it's amazing you can read with your fingertips. And he responds by saying, well, it's pretty amazing you can read by using your eyes and maybe along a page. And it is just a different, because things are different, it doesn't always mean they're remarkable necessarily. So I think, yes, people probably construct memory in different ways. Particularly people who've been severely vision impaired from birth or blind from birth.
I know there were schools established in the 18th century for teaching blind people, and various methods were introduced for touch reading. I guess
in my head that's the sort of the start of real assistance for people with vision impairment was Braille.
But would somebody who was visually impaired to that extent come under your remit?
So most of my research is looking at change, so people whose vision is changing, and that's partly because of the population of patients we see at Moorfields Eye Hospital, which is where the Institute of Ophthalmology is physically. But also I feel that it's a very different experience to not have any vision from birth as to having, as you mentioned earlier, this situation where people learn to do one thing visually and then later on have to use a different approach to do the same thing.
Right, and I mean, coming back to Bentham, he had problems with his vision. It's a pity he didn't have Moorfields Eye Hospital in his time, and he was always complaining about not being able to see. And I mean, he was fortunate in that as he got older, he was able to afford secretaries who could read to him from the newspapers and other small print books. And I know when he hired a very fine country house called Ford Abbey, and he had to wait for his books to arrive, and he said he couldn't read anything in the library apart from a Bible, which was in very large print, and started a critique of religion on that basis. But he was always trying to find sort of better lenses to help him read. And the problem for us now is that Bentham's late handwriting is notoriously bad, and it gives us great problems trying to read it.
One thing I find fascinating is that people have such different ways of learning and of gaining information. So I'll see people who will absolutely struggle and read very, very slowly with a magnifier rather than listen to something to get the same information. Even though it would be far quicker for them to listen. And equally, we all know people with very good eyesight who listen to podcasts at double speed and listen to audiobooks and prefer that way of accessing information. So I see, this isn't neurodiversity in a medical term, but I see this diversity of experience, diversity of wanting to interact with the world is something which is often exaggerated in people who lose one sense and have to rely on a different sense a little bit more. There's this cliche people have that people with vision impairment have better hearing, which is not necessarily true, although people are better able to attend to where things are when they have vision impairment, often better able to localise things. In the book I speak about a colleague of mine with severe vision impairment who bird listens rather than bird watches because he can identify birds so well and point to exactly where they are before his friends with good vision. So of course the interaction between different senses is really important.
And do people adapt? If somebody who might have preferred reading will then prefer listening, and I suppose nowadays you can get computers to read to, can't you?
Yeah, and when you hear people who've adapted to this and used it for a long time, they'll listen to things at 300 words a minute, which is almost indecipherable until you've tuned yourself in to listen to things that quickly. And I think this is, yes, certainly people do adapt to gain information in different ways. So Bentham today presumably would be using an iPad and having things read to him on that, or enlarging it to a very large size, or nipping down to a local optician to get a good pair of glasses. And this, of course, is the huge benefit of provision to healthcare. But globally, of course, there's still tens of millions of people with vision impairment because they don't have access to the right lenses. So although a simple spectacle lens is relatively cheap and easy to obtain, there's huge populations who just don't have access to that, and this is still a really big cause of sight loss globally.
Mm-hmm. And can you say a little bit about how your research is leading to treatments, or how you approach, I guess, the whole person, really?
Exactly. So there's lots of interest in treating disease, in removing the cause of vision impairment. So as you may be aware, there's lots of gene therapy approaches and stem cell technologies being developed which will help that. And that targets this sort of medical problem with the eyes. But my research is really focusing on the other impacts of vision impairment on people's lives. So difficulties in mental health and well-being, but also difficulties in interacting with society, and these sort of more general problems surrounded with having vision impairment. And I always say that the approaches I use are looking at how we can help people this week or this month or this year, rather than things like gene therapy, which is hugely exciting, but which won't be giving real benefits perhaps for 5 or 10 or 20 years.
Right. Do you think artificial intelligence is making things better for people with visual impairment?
Yes, I think in lots of ways. So practically, there are apps, free smartphone apps, which will read text to speech very effectively. Mm-hmm. There's also apps which will identify scenes, so it'll tell you how old you are. If I took a picture of you and said, "Oh, who is this man?" It'll describe your glasses and your facial hair and so on. And these are getting better all the time. They're getting built into glasses. So the new Ray-Ban Meta glasses have this capability. So there's a camera mounted in them, and it could give you live translation of things. So AI is very, very useful for that. So if you were walking along the street and you saw a shop name, it would read the sign and say, "This is W.H. Smith's," or "This is Boots," or whatever. And then if you pick up a menu, it will say, "Soup of the day, £3.95," and it will read things out through a little earpiece. But as AI is improving, it will identify what the salient features are. So the idea is you'd have this on all the time, and it would say, well, this is something which we need to know. There is an obstacle here you might walk into, or this is what you're interested in. There's somebody walking towards you who you know because that person's in your photo library, for example. Right. So this is something which is really sounds quite science fiction-y, but it's almost there in terms of live assistance through AI all the time. So this is an app called Be My Eyes. It's free. So for example, if I take a picture now across the room from here, it uploads this to the cloud, and the AI is telling me The image shows a recording studio with 2 men present. In the foreground, there's a round table with several microphone arms and headphones, including a setup for audio recording or podcasting. The man closest to the camera is wearing glasses and a blue sweater, sitting at the table with a microphone in front of him. The room has a modern design with white walls and a large window on the left. And then I can ask for more information, I can ask for clarification. So I'm going to ask, how old is the closer man?
Oh.
And of course, if I was vision impaired, I'd be able to dictate this and have this read to me.
I hope it says 21.
And the answer is, it is difficult to accurately determine a person's age just from a photograph, but the man closest to the camera appears to be middle-aged, possibly in his 40s or 50s.
Oh, I'll settle for that. Michael, thank you very much indeed for a really interesting and enlightening talk and helping us all understand a little bit more about vision impairment.
Thank you. It's been a pleasure.